Dear students, welcome to Bluepin Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
We'll go through the pericardium. Okay, pericardium and the heart. So what is pericardium? Any idea?
It's covering of the heart.
Covering of the heart. So it is a fibrous sac which is covering the heart and important major blood vessels. So we can divide the pericardium into two, outer and inner layer. Outer is the fibrous pericardium. Inner is the serous pericardium. Okay. Again, the serous pericardium divided into two, outer parietal layer and inner visceral layer. Okay.
Okay.
So the it is a fibrous serous sac and it is divided into two, outer fibrous and the inner fibrous. And outer parietal, again serous pericardium is divided into two, outer parietal layer and inner visceral layer. So these two are continuous with the blood vessels. Okay, and there is a narrow fluid filled space is there, that is the pericardial cavity. Okay, all right. Then next about the see the picture. So here you can see the fibrous pericardium and the serous pericardium, and in between the visceral pericardium. So visceral pericardium is very close to the viscera. So see the layers here. So this is the sagittal section of the pericardium. So here you can see the layers of the pericardium and the junction between fibrous pericardium and the blood vessels and all of it. And first about the fibrous pericardium. So I told you the apex is blunt and it is fused to the roots of the great vessels and fascia, and it is inseparable. It is not. It can't separate from the diaphragm, and this is attached to the sternum by the pericardial ligament posteriorly with the esophagus and bronchi. On each side, it is related to mediastinal pleura and phrenic nerve. And the phrenic nerve is innervating the diaphragm and it will protect from the sudden overfilling. So see, this is the pericardium, which one they are pointing, this two.
Yes, ma'am.
And next is the serous pericardium. It is a double-layered membrane which is lined by mesothelium. Mesothelium is an epithelium, and it is having outer parietal and inner visceral pericardium. And two layers are continuous with each other at the root of the great vessel. Okay, and visceral layer that is very close to the heart, and pericardial cavity, it's a potential space between these two layers, and it contains a thin film of capillary fluid, so which helps to lubricate. Okay, so these are the layers. Then next about the pericardial cavity. So it is a double layered membrane which is lined by mesothelium, I said. So in between these two layers there is a fluid filled cavity. That is the pericardial cavity. So next about the sinuses of the pericardium. There are two sinuses, oblique sinus and the transverse sinus. So these pericardial sinuses form during the heart development, during the development of the heart, in the form of a folding of primordial heart as a consequence of folding of the primordial heart too, but doesn't have any clinical significance. So next about the oblique sinus. So the oblique sinus, where you can see the posterior surface of the heart which lies behind the left atrium. So oblique sinus is a blind recess which is formed by the reflection of the serous pericardium. So where you can see this around the large veins in the case of inferior vena cava and left pulmonary vein. So here you are able to see, they are showing with their two hands, they are showing the gap. So this is the oblique sinus. Understood, Narisha?
Yes, ma'am.
Next is the transverse sinus. So this also you can see in the back of the heart only. It is a wide passage between your ascending aorta and pulmonary trunk, or we can say anterior to your superior vena cava or superior to the left atrium. Okay, I'll show the, see, this is the gap. Transverse sinus. See, again they are showing this index finger is passing through the sinus. So next about the nerve supply of the pericardium. So as you know, the parietal layer which is supplied by the phrenic nerve, visceral layer by the sympathetic trunk and the vagus nerve.